everyone. My name is Tina Swanek, and I am the Career Explorer Northwest producer for KSPS PBS Public Television here in Spokane. Just a real quick background on Career Explorer Live. Career Explorer Northwest Live is an interactive Zoom event that connects young people with professionals so you can learn about careers and career paths. And for today's event, it's a joint Career Explorer Northwest Live and Business After School program brought to you in partnership by KSPS PBS and Greater Spokane Incorporated. So here to welcome you from GSI is Director of Education and Talent, Rebecca Clemens.
Welcome to Career Explorer Northwest Live. I'm Rebecca Clemens, Director of Education and Talent at Greater Spokane Incorporated. GSI is Spokane's Chamber of Commerce and Economic Development organization. We're excited to bring you today's event, a collaboration between Career Explorer Northwest Live and the Business After School program. This interactive Zoom session is designed to connect you with professionals across a variety of industries, helping you explore different career paths and gain real-world insights. GSI is proud to partner with KSPS PBS to make this experience possible and look forward to an engaging, informative session.
Thank you so much, Rebecca. And during today's event, we're going to be exploring ultrasound technician careers with the help of our special guest, Sarah Wendell from Inland Imaging. Real quickly, Inland Imaging is home to more than 125 specialized radiologists working in 13 subspecialized modalities. Those physicians, supported by nearly 1,000 technical, clinical, clerical, and professional staff, serve healthcare providers and their patients in Western, Central, and Eastern Washington, Northern Idaho, Eastern Oregon, and Western Montana. Inland Imaging's mission is to deliver fast, accurate diagnostic imaging, professional radiology services, and compassionate patient care that provide answers to help guide and support patient care. The company operates 9 outpatient imaging centers equipped with state-of-the-art technology, conveniently located throughout the region. Sarah, who's now up on our screen, has worked for Inland Imaging's ultrasound department for just over 8 years, and she's the lead sonographer at Sacred Heart Medical Center. She's registered in abdomen, vascular, breast, OBGYN, and pediatrics. Hello, Sarah, and thank you so much for being here today to share information about your career and career path with our student guests.
Hi, thank you for having me, Tina.
Okay, we'll hear more from Sarah in just a minute, but now let's meet our high school guests that have joined us today. So with us today, we have Newport High School, and we also have University High School. And along with each high school, for Newport, we have College and Career Resource Specialist Soraya Pierce and Instructor Katie Wardrop. And with University High School, we have Running Start and College and Career Counselor Nicole Rippey. Thank you all for being with us today, and we look forward to your questions later. Okay, before we get started with the main portion of our event, I want to quickly share the agenda. As I mentioned, Sarah is going to share with us a little about her education and career journeys, and she's also provided us some really interesting images that pertain to what she does as an ultrasound technician. And she's going to do a short demonstration as well to kind of give you a feel for what that looks like on the job. And then we're going to open our floor to questions from our student guests. We won't be taking any questions through chat today. We're instead going to engage in this live discussion. Okay, let's get started. Welcome, Sarah. Would you mind sharing with us a little bit about your education and career journeys that have been part of your life as you've gone into this role as an ultrasound technician and as you've worked as an ultrasound technician over the years?
Yes, thank you. So I just wanted to say how much I like that you do this with the high schools, because right out of high school, I actually didn't even know that this was a field. I think maybe I had seen a couple ultrasound images maybe in movies before. It was always just the grayscale, a baby here and there, but really I had no idea about the field. So when I first went to college out of high school, I was at WSU studying accounting, and then I decided that that wasn't going to be for me. So going into my last year, I completely switched and went into anthropology. It's a fascinating field, but there wasn't a lot career-wise to do with that after graduation. And so I was thinking on, what else can I do? What would be fun for me? What would I love? And by that point, I had a few ultrasounds myself. And every ultrasound tech I ever met really, really loved what they did. So I started looking into it. found the school here at SEC and enrolled and started taking classes. And I've loved it ever since. Would you like to go ahead and start showing some of those pictures?
Sure. Yeah, absolutely.
So I wanted to show something that would make sense to people that are not used to looking at ultrasound. So what you're seeing on the screen is an ultrasound image of the liver. Specifically, this is the right lobe of the liver. Towards the left of the screen is towards the patient's head, and towards the right of the screen is towards the patient's feet. And you see that liver tissue in the image. You see it kind of outlined with that white border, that bright white border. And then kind of centered, but towards the bottom of the liver, something kind of stands out right there. It's a darker gray ring around something that looks like it's bulging. So that's actually a liver mass. We do routine screenings on patients with liver disease, looking for masses like this, so that we can detect them early, they can get treated, and go on to live longer lives. So that's what a liver mass looks like. This patient had a partial, what's it called, a hepatectomy, where they removed part of her liver to get rid of that mass, and she's doing well to this day. So this is breast. We do a lot of breast imaging and ultrasound as well. This is what a breast cancer looks like. You can see just that dark, shadowy figure there. The borders of it look kind of angry, spiculated is what we call it. That's what they say. It's not respecting the tissue planes. Those are all things that really make it stand out as a breast cancer. This patient was pretty young and near and dear to me. She's a good friend of mine, and she's doing great. The next image is of us biopsying that breast mass. So we do a lot of ultrasound guided procedures. As far as like biopsies, if people get fluid buildup in their abdomen, we can remove that. Do a lot of MSK procedures as well. But they like to do some tissue sampling of any mass that we find, because it tells them a lot about that particular mass, and how they can go about treating it. So this patient ended up having a bilateral mastectomy, and she's doing fantastic, super healthy. She still has her scans every once in a while, but she's completely cancer-free. And that you can see that kind of bright white line going through the center of it. That's what a biopsy needle looks like. It's just going in and grabbing some of that tissue so that the pathologist can take a look at it. And then I'll show you the next image. This is a gallbladder. So you can see that kind of black, slightly ovalish shape there. That's the gallbladder. It looks black because it's full of bile. Bile is a liquid, and it's not reflecting the sound waves. So anything that you see within the gallbladder that is reflecting sound waves is something that's not supposed to be there. So you see that kind of like low level layering echoes towards the bottom. That's called gallbladder sludge. That's just stuff that accumulates, basically is just what it sounds like. It's sludge in there. And then sometimes that hardens and calcifies and it forms gallstones. You've probably all heard of gallstones before. Those are those bright white kind of round structures down there at the bottom of the gallbladder, and they shadow behind them because they're not letting any of the sound waves penetrate through them. So that's why you see shadowing back behind. So that's how we search for and diagnose gallbladder issues, if somebody's having like right upper quadrant pain. Sometimes it's epigastric pain, bloating, things like that. It could be gallstones causing them problems. Next image, please. This is one of my personal favorite fields of ultrasound is pediatrics. So what you're looking at is the brain of a baby. After babies are born, we're actually able to see very well through their anterior fontanelle at the top of their head to look inside their brain and check on their health. So we can look for anatomical anomalies, make sure that their brain has all the structures that they need, and if not, so that's known. Also, when babies are premature, tiny little blood vessels in their brain can rupture and hemorrhage. So probably the most common reason to do an ultrasound of a baby's brain is to check for hemorrhage. That way their doctors know how to manage any blood thinners that they need to be on or anything like that. This baby, you can see, so the brain is supposed to be really symmetric, but you can see on the image, the left side does not look like the right side. That's because the right side has that big white blob looking thing. That's actually a stroke. That's what a stroke looks like. And it's kind of, you can see almost pushing into the other side. We call that a midline shift. So that's so bulgy that it's pushing basically into the other side. So that was something that baby's doctors really needed to know about so that they could take care of them the way that they need to be taken care of. And then next image. Or I think, oh yeah. Oh, this is one more. I'm sorry, it looks gray. So you can see kind of some brighter areas. They look like little, I don't know, they're blood vessels going in and out of the kidney. This is a picture of a kidney transplant. This is another one of my favorite studies that we do. For the transplant surgeons, we take a look after they're done placing the transplant in the patient and just check to make sure that the blood flow looks good, blood flow going into the kidney looks good, going out of the kidney looks good, and everything else about it. Make sure it doesn't have a urine backup, no bleeding around the kidney, anything like that. And so this is just a picture of a nice, beautiful, healthy kidney transplant for a patient. And I think, oh, and another one. So this is a picture of a testicle. You can kind of see off to the right of the screen, that's the left testicle, and then the one that you're looking at is the right. And similar to the liver, you can see what the normal tissue looks like, and then centered in it, there's different looking tissue. It's a little bit darker compared to the rest. That's what a testicle cancer looks like.
Well, thank you so much for taking us through those images. And obviously,
Yeah.
as part of your training, you learn how to read these images because, you know, it's very difficult as a layperson to really understand what you're viewing. So thanks for walking us through and also explaining what the healthy tissue was and what the, for lack of a better term, diseased tissue looked like.
Yes, that's a perfect term.
Appreciate
Yeah.
that. Okay.
Yep.
Okay.
So ultrasound techs, we get a lot of questions around, you know, I know you know what you're looking at, or do you know what you're looking at, or anything like that. We have to know what we're looking at, and a good idea of what it is to know what to go searching for next and what to show our doctors, because basically our radiologists won't see it if we don't show it to them. So you get highly trained in human anatomy, physiology, and different pathologies, as well as the ultrasound physics. We're working with a lot of physics because it's based on sound waves that we hold this. This both sends out sound waves, and then it also receives a message, and then this machine is smart enough to be able to display it onto our monitor so that we know what we're looking at and what to search for next to help the patient get the diagnosis that they need. So ultrasound techs do have a really good idea of what we're looking at. However, we don't actually diagnose. There's always differentials in the mix. Even that liver mass that I showed you earlier, I would never confidently say that that is a liver cancer. There are benign masses that happen all the time in the liver. And really, it's the radiologist's job to take a look at it, to give the ordering doctor a list of differentials and ideas of how to confirm a differential. So whether that's tissue sampling or an MRI or, whatever else they might need. So I am going to do a little demonstration. I have one of my friends and coworkers here today. Her name's Erica. She's 22 weeks pregnant, having her second baby girl. And so I'm going to show you some live scanning of her baby. And Erica said she's been very active today, so that's good. She might be on screen. Okay. So right off the get-go with OB ultrasounds, I'm going to give you a little more gel. Sorry, we use lots of gel with OB scans. Turn the screen a little more. There you go. So all of that black in there, like I was saying earlier with the gallbladder, that's fluid. So that's amniotic fluid. This is kind of a cross-section of baby's abdomen here up into chest cavity. You can see the heart beating. Baby's moving a little bit. And then if I lengthen out on baby, here's some limbs, some legs up here, some feet getting ready to kick Erica. You can see baby kidney there, baby kidney there. Here's the spine. So at 22 weeks, we typically be doing a full anatomy exam where we look at the heart, all the chambers of the heart to make sure that baby is going to be born healthy and isn't going to need a team there available on site. We look at the spine, check for any spina bifidas. We look inside the baby's brain. Here's a couple brain structures. They're called choroids. We check out the limbs, make sure they're doing okay. This is actually the umbilical cord. It's inserting into baby's abdomen, which is kind of, she's got her legs kind of up right now, but it inserts into the abdomen and then it inserts into the placenta. Placenta is this right here. That's what gives baby the nutrients basically from mom. Looks like she's maybe able to get a little profile of her. So this is an image kind of looking at baby from this way. So this is her nose. These are her nostrils. She has a hand up here right now covering her lips, but we can see them a little bit. Chin's there. A little bit of cheek in there. Closed eyelid. It's a little bit brighter white, right? And the closed eyelid, those are little eyelashes. Looks super sweet. And then may not be able to get, sorry, Erica, I'm kind of digging into your hip a little bit. Not able to get that really classic profile picture just with how she's facing right now, but you can get a feel for that she has her hand right up there. So while checking on baby's health, we can also check on mom's health. We take a look at their ovaries on OB ultrasounds. We still care about those, making sure they don't have any cysts or anything on them that we need to know about. Another common exam for a pregnant patient would be to check out their kidneys. Sometimes the uterus grows so much that it actually puts pressure on their ureters, and so kidneys don't drain so well. I'm going to show you what Erica's kidneys look like. Oh gosh, you can see your kidney so well. It's just right there. So her kidney's so close to the surface that I'm actually not even able to fit the whole thing in the screen, but you can get a feel for that it actually looks like a kidney bean. It's kind of this oval rounded thing, and we can check and make sure that's all healthy. I'm going to show you Erica's gallbladder too, because you might have something in it. Where are your stones, Erica? They might be hiding up there in the fundus. Can you take a deep breath in? Make sure the neck looks fine. You guys see how it looks? It looks all black to me, so I'm not seeing any reflectors in there. We're getting maybe the tiniest bit of shadowing from some bowel that the gallbladder is near to. Go ahead and breathe if you haven't already. But I'm not seeing any echoes in there. Last time I scanned Erica, there was a little bit of sludge in there that we were thinking may have hardened, but it looks, that kind of just looks like nearby tissue. this that you're seeing here, this is liver tissue, nice healthy liver tissue. Um, One thing that we routinely check on with the liver is the main portal vein. It brings about 70% of the blood flow into the liver. This is what color Doppler looks like. So color Doppler, it uses a Doppler shift basically to detect any motion. So this is telling us that this blood flow here is moving into the liver, because if you check out the color scale, red is moving up. And so this blood flow here is moving up. This blood flow here is moving away. That's because those are hepatic veins and they're going back up into Erica's heart. I'll show you what the heart looks like because it's kind of fun to see that beating too. Deep breath in. Thank you. So if I angle way up into her chest cavity, you can see just a little bit of liver now I'm scanning through. And then this is her heart. These are her ventricles. And then atrium would be way up here, way high up on her. A fun fact about Erica is she actually went to school to be a echo tech first. And echo tech is somebody that specializes in the heart. Oh, there we go. Here you can see her atrium nicely, her valves, and then her ventricles. So something important to know about if you do choose to go to school for ultrasound, you can go ahead and breathe, is at the program here in town, you can specialize in 3 different fields. One of them is echo, which is when you specialize specifically on the heart. One of them is vascular, where you specialize on the arteries and veins of the body. And one of them is general, where you do everything else. OB, abdomen, small parts like the thyroid, testicles, lumps and bumps. You can go into MSK, that's musculoskeletal. From general, you can also cross-train into anything else. So I'm registered in vascular as well. That's something I chose to do after working in the hospital field. I got to scan quite a bit of vascular, and I think it's really interesting. So I was registered in that. At Sacred Heart, we don't do any echo in our department. So unfortunately, I haven't had nearly as much exposure to echo. I think it'd be a really interesting field too, but it's a lot of fun to do general because you can then cross-train into other modalities as well.
Okay.
Does anybody have any questions about any of that or getting into
Yeah.
the field or the school here?
Yeah, that's a great segue. I think, yeah, let's move right into the Q&A. And I think if we could start with a question from Newport High School, and then we'll have university ask questions after that. And we'll just go back and forth between the 2 schools for the next 20 minutes or so. So Newport, what is your first question?
My question is, like, did anyone inspire you to join the job, or did you like just get your ultrasound and then wanted to be inspired?
Yeah, no, I didn't personally know any ultrasound tech, so I was not inspired by anybody around me. It was just I started having ultrasounds and I would, talk with the tech and they always seemed to love what they did. And so I took that as a really good sign that it must be a great field. If somebody in it is talking it up so much while they're working and, I took that as a sign, I guess. And we're very lucky here in town to have this school right there at SCC. It's nice to not then have to go back to a 4-year college. It's a little bit cheaper. Um, and it's great to have here because I think there's only one other ultrasound program in Washington State, and then there's one in Idaho, it's in Boise, and one in Oregon. So we're lucky in Spokane to have that program right here at home.
University High School.
What does a typical day look like for you, like your schedule?
So there's a couple different environments you can work in. One of them is kind of an outpatient clinical based, and then one is at the hospital. I used to be in the clinics more. Now I'm based mainly at Sacred Heart. So in the hospital, what it looks like is you come in and you have no idea what you're about to see or scan. The inpatient doctors and the ER doctors, they order ultrasounds as they're needed. So things basically orders print, they come up on my screen. I see the type of exam that it is. I look into the patient history, any surgical history. I know to not go looking for their gallbladder if they've had a cholecystectomy. I look at their lab values to have a good idea of what puzzle pieces I'm going to be helping to fit together. And then I basically bring the patient into the department. We have a transport department that does that for us. And then I scan the patient. I write up an online form telling our radiologist a little bit about the patient and my impression on things to help them out. Sometimes I go talk with them in person if it's super important. And then I send the patient back to their room, and then get ready for the next one. If you're working in more of a clinic setting, when you come in for the morning, you get your schedule pulled up. There you do have a schedule that outlines at what time the patient will be arriving, how much time you have to do that exam, what exam it is. You're a little bit more limited on looking into patient information. You rely on them a lot for their history because you're not provided with a full report on them. So surgical history, lab values, things like that. You're asking the patient a lot of those questions. In a clinic setting, you're likely to scan a lot more patients in a day. In a hospital setting, you're likely to scan less patients in a day, but they're higher acuity. And you're also often going portable to other departments like the ICU or the PICU, that's a pediatric ICU, or the NICU, because those patients are too sick to come to the department.
Newport, next question.
What are the most common complications you see?
Common complications. You mean like pathologies that we might find?
Yeah.
A really common one in our area is like cirrhosis. We scan so many livers in ultrasound, and cirrhosis is basically when there's scarring of the liver. It can happen from, things that they ingest, basically lifestyles, or it can also happen from no doing of their own. Those patients we see a lot in ultrasound because then we start doing screenings on them. And then also sometimes they can build up fluid in their abdomen, and then we're doing procedures to remove that fluid. So I'd say out of all the pathologies I see, cirrhosis is probably the most common. Gallstones are very common. Ovarian cysts are very common. Fibroids in the uterus. DVTs, deep venous thrombosis. Those are also extremely common to see. Not that you don't want to get it addressed, just a common finding.
University High School.
My question was, is it hard to see like sad things and like keep your composure because you're not allowed to say them?
Yes, it is. It can be so hard. You're knowing things about somebody before they know it about themselves. Even things that aren't that sad are sometimes hard to know about a patient, because I know while I'm scanning them and talking with them that they're probably going to be going to the OR very shortly. But of course, that would be really unfair of me to tell them that, because that would scare the crap out of them when there's not even a doctor in the room to talk with them about treatment options and things like that and explain things to them. And I'm not prepared for that. So even finding something like appendicitis can be hard, because you're talking with them and you know what's about to happen and all the nerves that come along with that. And then there are other things that definitely get even more sad. There's cancers, and there's childhood cancers, and that's all very sad and scary too. And what I've basically had to tell myself is that if they're going to have to be going through that, then I want to be there for them, helping them go through it. Because even though my part is so small, if I'm friendly or I, just talk with them, I get to kind of hold their hand, that makes it a little bit better and a little bit less sad.
What are like the most important character traits or skills to have like to be a good ultrasound tech?
That's a good question. I think multitasking is a really important skill. Personability, your patients are scared at the time. They're experiencing something totally new to them. Even if you've seen it 1,000 times before, it can be really scary to be a patient. So you want to be personable. You want to be caring. I think having a good, healthy level of curiosity is also very helpful as an ultrasound tech because I consider myself kind of nosy and curious. And so while I'm scanning a liver, I'm probably going to be checking out their right and left kidneys as well, just making sure I'm not seeing any incidental masses or anything like that. It's a job that you are constantly learning in. And so having that curiosity and that joy for learning will make you go pretty far and will make you a really good ultrasound tech.
University.
How do you stay current with new ultrasound like techs and or techniques and like technology?
That's another really good question. At Inland Imaging, we're pretty fortunate because they focus a lot on not only our culture, but also our education. So there's always education opportunities through work. They frequently will get like study groups together if you want to study for another registry. We're always talking to each other about, have you seen this before? What do you think this is? Kind of comparing notes. And then also we can go to conferences, which are radiology-based conferences in other states or even countries, where you have the best of the best talking about the things that they know, things that are cutting edge, different areas of ultrasound you might have not known about. And then you can also make connections with people from far away that maybe work in different hospital systems, see different things. So there are always ways to learn new things in the field.
What scares people from doing what you do?
Oh, it scares people from doing what I do. Probably. So if you do choose to start looking into the ultrasound field, you might have people tell you that it's really competitive. And that's true, it is really competitive. The school here takes 16 general students a year, and then I think typically 16 echo and 16 vascular. But that is out of a lot of applicants. So it's true that it's very competitive, and that likely scares people out of it. But honestly, if you know that you want to do it, I would not let that scare you out of it. Other than the competitiveness of the field and, fear of failing or not getting in, I can't think of much that would scare people out of it other than maybe in a hospital setting, you are dealing with some blood or some pus, some really nasty things that can probably scare people. The first few procedures that somebody watches, I would suggest that they, kind of sit down if they start to get woozy or step out of the room, because that can be a little bit, weird at first to get used to, but I don't think that would really scare people out of the field.
University.
How many hours a week do you work? Like how big is your workload? How much free time do you have?
So personally, I'm full-time. So I'm scheduled 40 hours a week. I will go over that a lot of the time. There's always opportunity to pick up another shift, a graveyard, a weekend, things like that. You get paid overtime. So a lot of us choose to do that because it's not only beneficial for the department, but then also it's beneficial for your wallet. But that being said, there's all different positions. You can do part-time, you can do supplemental when you say how much you're going to work. So there's a big variety with workload.
What is the coolest thing you've learned just in your day-to-day work life, medically?
The coolest thing I've learned medically in my day-to-day work life?
Yes.
I don't know. That's tough because I feel like everything that I've learned was in my day-to-day work life. The coolest thing no, because you said medically. I was going to talk about remembering to be humble, because you'll definitely be humbled, and that's a big thing that I've learned. Medically, I mean, I feel like I know so much more just about the human body and how it works, that I really can't think of one thing that would be the coolest. I guess transplants or how those work, or getting to be part of the OR or the medical decisions of the surgeons. I mean, that's pretty cool to get to be a part of that team. I'm sorry if that didn't answer your question very well. I think that, yeah, Erica was saying that's part of what's really cool about ultrasound is you just continue to grow and learn, and it's just never ending.
Okay, university.
I guess my question is like, is there a certain exam that you have to take to earn your certificate to become an ultrasound tech? Or like, what is it that you have to do to be considered one of the like 6 accepted?
Yes. So you have to go through a ultrasound program. Here that's about 2 years of prereqs to get into it, and then 1 year on campus in your classes, and then 1 year in clinicals. While you're in school before clinicals, you're allowed to take your first registry. It's a physics registry, basically the sound waves, the machine physics, what you can adjust to improve your quality. So that's the first registry you have to be an ultrasound tech. And then you need one other kind of a base registry. So if you're an echo tech, you would need to then take your echo exam. If you're a vascular tech, vascular exam. And then if you're a general tech, you would want to likely do your abdomen registry. However, some just have OB, some just have breast. And you have to have a certain number of clinical hours in order to be able to sit for those exams. They're each about 180 questions, and you have 3 hours to take it. You go to a testing center. It's completely quiet. They have some big intimidating rules. I once forgot chapstick was in my pocket, and I panicked when they found something in my pocket. And then so that's just the basics to be registered, a registered diagnostic medical sonographer. And then you can build from there. So then you can go on and be registered in more fields if you're interested.
I think we have time for 1 or 2 more questions, depending on the length of answer, I suppose, that's required to fulfill the question. So we'll start with Newport.
Are you ever on call?
I very luckily am never on call. Actually, nobody at Inland Imaging in ultrasound is ever on call. We are staffed, so meaning our graveyard at Sacred Heart, we have 1 graveyard tech that is always on, and at Holy Family, we have 1 graveyard tech as well. Taking call is definitely a thing of the past for us. In other areas, I'm pretty sure multi-care has call, Kootenai likely has call, so call can be a big part of their lives. Yeah, smaller hospitals, rural hospitals that, there might be 1 exam ordered in the middle of the night, they might not. They probably don't want to staff a whole person to be there on the off chance that something is ordered. But we're luckily big enough and busy enough that we don't take call.
Okay, university, this will be our last question.
You may or may not know this, but you mentioned radiology, like you work a lot with radiologists. And so for students thinking about going into ultrasound, like the difference or pros and cons of ultrasound tech versus radiology tech.
Oh, yeah. Yeah, so meaning the different imaging modalities, like radiology as an X-ray. And then I guess I should explain, because I said the word radiologist, and that can be confusing because radiology is often, it can be used as an umbrella term for all of the imaging modalities, and it can also be used for just X-ray. So radiology to me is X-ray, MRI, CT, nuke med, ultrasound, all of those. But X-ray itself is also called radiology. And then a radiologist is a doctor. They go to school for like 14 years to do what they do. And they are trained in all of those fields, all those imaging modalities to be able to look at any of that imaging to make a diagnosis. So pros and cons, I'm of course very biased towards ultrasound because I really enjoy that I get to use this magic wand basically and look and solve problems for myself. Like I said, I'm really nosy, so I can scan around, and I feel like that gives me a much more active role in the patient's course of treatment. I I should probably spend a day in CT or X-ray or somewhere else to be able to fairly say, but I feel like, their scanning isn't handheld. Their scanning is they're positioning a patient, and then the machine is doing it. With ultrasound, that is really the only modality that the machine is not scanning the patient. The tech is getting to actually scan the patient and knows when to take images and how to take them. So I feel, and no radiation, like Erica just said, there's no radiation with ultrasound too. So that makes it very safe on pregnant people. And then also one of my other favorite patient populations, children. We're kind of the first line for children. They get sent to us.
Okay, I think we're getting close to the end of today's event, so we have just a couple of minutes. Is there anything else, Sarah, that you'd like to add that wasn't addressed during the Q&A that you think is important for students to know if they're considering a career as an ultrasound technician?
Nothing I can really think of. I would like to stress, how important it is to not be scared out of the competitiveness of the field, because if you're truly interested in it, I mean, I think it's definitely worth just going for it. We have a lot of ultrasound techs that did not get into the program their first time around, and they come, or even their second time around. They come back and they try again, and then they eventually get in. When you're on the right path for you, doors will eventually open up. You just have to kind of keep trying, and when you're young and you're right out of high school, that's kind of the perfect time to try and fail and then to try again. Shoot, I did have something else on that thought. Oh, one really good way to, if you're trying to ensure that you can get into a program, one thing that a lot of people have found that helps them is to find a job in that field somehow, whether it's being an ultrasound assistant or a CT assistant or a patient transport. The school will take a look at that and be like, oh, they've been in the medical field. They have a good idea what things are like. They probably have some staying power. I mean, they're not going to want to, they only have these 16 slots. So they want to make sure that every person that they fill in those 16 slots is going to have some staying power and is not going to leave, because they find out that they don't actually like patient care. Personally, I didn't have any medical experience, so I consider myself extremely lucky that I not only got in, but that patient care ended up being the right field for me, because it really is, in my opinion, the funnest field that you can be in is ultrasound. And other than that, just whatever you end up doing, just make sure that you really, really love it, because it is so much fun waking up every morning and being excited to go to work and like, what am I going to see today? What kind of people am I going to meet? And then enjoying your coworkers and the culture of your environment is also very, very highly important, because you're going to be with those people and in that environment for, whatever it is, like 20-30% of your life. So you want to make sure that you're in a home that's really good for you.
Great. Sarah, thank you so much for being with us today and sharing all of that fantastic information that I hope will help our students to decide if this is a career that really is a good fit for them based on what they've learned today. And I know there's a few that are already in medical programs, and that's also helping them to make that decision as well.
Oh, good.
So I brought everybody back up on the screen. Again, thank you, Sarah, for your time and all of your effort today to share information with our students. And thank you especially to Newport High School and University High School for participating today. Great questions, by the way. Fantastic job developing those questions. I learned a lot just through the questions that you asked. That was fantastic. So I think this is going to basically conclude our event today. So we will go ahead and wrap up this event with a message from Rebecca Clemens.
Thank you, Tina, and thank you, Sarah. I would like to say thank you all, Newport and University High School, for joining us on Career Explore Northwest Live. On behalf of Greater Spokane Incorporated, we hope today's session helped you explore a new career path, connect you with a professional, and gain valuable insight into what you want to do in the future. We are proud to partner with KSPS PBS to bring these experiences to life and support your journey toward success. Please keep asking questions. You had great questions today. Continually stay curious, and we look forward to hearing where your path leads you next. If you have ideas for a speaker or a career that you would like highlighted in this format, please let us know. Thank you so much.
Thank you, Rebecca. And we're so happy to be partnered with GSI for these events. They're just an amazing partner that brings a lot of really interesting occupations to the forefront. So that concludes Career Explorer Northwest Live.